Hello everyone, I'm Carla Macias, host of Best Docs Network here in Austin, Texas, the show that's bringing you some of the best doctors in your area that are part of one of the top medical facilities in Texas, and that is Forest Park Medical Center. Now let's get today's show started by introducing one of these Forest Park physicians, plastic surgeon Dr. Jeffrey Koman.
Charlotte was born through a C-section, and when I first saw her, I thought maybe her ear was folded over just because that was how she was in the womb, but it became pretty clear after the next couple of days that it wasn't going away. It was just floppy, the cartilage wasn't formed properly, and so we decided to try and fix it.
As a practice that specializes in pediatric reconstruction, one of the most common deformities that we see are deformities of the ears. The standard of care for these historically has been surgery. You wait until the child's in kindergarten or first grade when it becomes a social issue, and then there's a type of surgery called otoplasty that we perform. In 2010, the FDA released an ear molding device, which has radically changed the way that we manage ear deformities.
I just know kids can be really mean, and I certainly didn't want her to not be very self-conscious about it until she started going to school and then have people make fun of her and have kids say mean things about her. We chose the ear wells over plastic surgery because we thought it would be a safer option for all of us, and we just didn't feel very good about her getting surgery when she was even 4 or 5. I remember Dr. Koman being so friendly and being so kind and explaining to us exactly what was going to happen, exactly what was going to go on. He said Charlotte was a perfect candidate for it.
It has an external cradle which sticks directly onto and around the ear, and then we have customizable pieces that help hold the ear to a normal shape and position. So you keep the earwell device on for 4 to 6 weeks so that the ear has had enough time to learn a normal shape.
I was really, really happy with the results and the fact that it was virtually painless. I am extremely grateful that we did it when we did, because the cartilage wouldn't have formed if we would have waited. Time was of the essence and we needed to do it as early as possible. So I'm very grateful that we were given information for Dr. Koman so that we could jump on it real fast.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and snack at the same time each day. Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
Probiotics are basically certain strains of bacteria that are innate in our digestive system, and they're beneficial. We have kind of a symbiotic relationship with certain kinds of bacteria. So these probiotic things that you see in the stores or that you see commercials for are just strains of certain kinds of lactobacillus or other bacteria where they're trying to give you a mega dose to try to repopulate your digestive system with good strains. So the issue is that most of us are just fine. We don't really need to be supplementing all that. The time when it can be really beneficial is if you have a real bad gastroenteritis and some diarrhea from traveling and so forth. Probiotics actually have been shown to shorten the course of that. But overall, they're not something that needs to be used for a prophylactic reason or for any kind of dietary supplement reason.
The things that make Forest Park unique are our focus on what's best for the patient and what's best for the physician. We're different in many ways than other organizations because our physicians are our owners, they are our bosses. And to that end, we want to do whatever we can to be sure that they get their needs met.
We're here for them, they're here for their patients. And working together, and we're not fighting a bureaucracy, we're not fighting a corporate office that's not even in the same state as us sometimes. We're making what's best for this hospital at this moment at that time. We don't have to wait, and that's what our physicians like, immediate results.
As new things become available, like the Mako robot, some of the new technologies, Forest Park's very quick to want to be a part of those things. If that's something that our surgeon wants or feels like would benefit his patient population, we're willing to do that for them. And that's exciting to have an organization that leaps forward that quickly.
It is just very much more collaborative. They're very involved in their choice of equipment. We try to involve them in any major decisions so that they feel that they have a buy-in to this, they're part of it. One of the physicians said to me the other day, I feel like I've worked with this team for years because they just got the flow down. It just works.
Caitlin has a question for Dr. Esparza. How important are shots for children?
Immunizations are very important. They prevent illnesses. We have immunizations to prevent certain types of meningitis, certain types of ear infections, polio, other illnesses that are contagious as well, like measles, mumps, rubella. Sometimes people don't see these illnesses, and if they don't see them, they forget that they're still out there. But the reason you don't see these illnesses anymore is because people have been immunized.
Forest Park Medical Center and their physicians make it a priority to get involved in their communities. They especially take great pride when it's close to home. Up next, we're going to take a look at one of our Forest Park campuses and how they participated in this year's Jersey Night at the Texas Legends game.
The Miracle League is a youth sports organization for children with special needs. Tonight we're honored by being a guest of the Forest Park Medical Center Frisco and the Texas Legends as part of the Legends of the Game series.
A while ago we sponsored the Miracle League and the Turkey Trot in Frisco, and now we participate with the Legends, and we a game for sports for the kids, for families. And a while ago the Legends came and said they are very community orientated as well, charitably orientated. So the three of us came together and chose to do this event tonight. Thought it'd be a good fit. Again, it supports the Miracle League, gets the kids involved in sports, us involved in the community, and the Legends get to give back as well. So we decided it was just a great fit.
Tonight's game is all about Forest Park Medical Center and the Miracle League of Frisco. And, really I couldn't be more excited to have two great partners like that here. Obviously being a basketball team, the opportunity to give back to a group like the Miracle League of Frisco, have, our youth come out, basketball players come out, those who may not always have had the opportunity to participate in sports. It means the world to be able to put smiles on those kids' faces, and, really props to Forest Park Medical Center of Frisco for helping to make that happen.
Forest Park is a culture for us, and it's about being in the community, living in the community, and working in the community, and caring in the community. And that's what we feel we do, and we give back every day, just not only in the work we do, but then when we go outside of our walls, and we give back to the community when we're outside as well.
The Miracle League of Frisco would like to extend a special thanks to Forest Park Medical Center in Frisco and the Texas Legends. Their partnership is invaluable to our organization, and we believe that the partnerships in the community like that help everybody in the long run.
Vector vision is like a GPS system for the brain. A MRI can be done and digitized to an instrument in the OR. So in real time, you know with your instrument where you are on the patient's skull, within the brain, or within the white matter itself.
Image guided.
smaller incision, better cosmesis, faster healing.
As a state-of-the-art medical facility, Forest Park Medical Center is unrivaled. So, naturally, it's where the finest physicians in North Texas want to work. And because of the extraordinary level of comfort and care provided to our patients, Forest Park Medical Center is where they prefer to come to. We're just happy we could bring them together. Come experience for yourself what medical care was meant to be. Forest Park Medical Center, your destination to better health.
BestDocsNetwork.com is the right place to find the right doctor for you. On our homepage, you can browse through our gallery of all the different specialties a part of this group. One of those doctors you can find on our website is bariatric surgeon Dr. Michael Lee. Now let's listen as Dr. Lee discusses the gastric sleeve.
I was a skinny kid. I've always been a skinny kid until I hit puberty, and then I slowly started to pack on the weight. College, eventually, I hit my highest weight I've ever been. Once I tried on my wedding dress and had to struggle between sizes and alterations and never really have it fit right, then I knew I needed to do something.
Alexandra is a patient who had been seeing a GI doc for vague abdominal pain, and it was unclear whether she had a problem with her esophagus or her stomach. I'd seen her in clinic, and she was telling me about how she had been overweight her whole life. I felt like if she could get enough weight off her midsection and decrease the amount of intra-abdominal pressure and getting rid of that obesity, essentially, that would in effect help out her reflux disease.
Dr. Lee laid out that I probably should get the gastric sleeve instead of gastric bypass because I wasn't as overweight if I continue with the weight gain. I feel really good. I've never felt better. As of the day after surgery, I had no acid reflux and no indigestion. I'm shocked how much the weight loss has caused me to feel the energy I have. I thought Dr. Lee was really personable, easy to get along with. I'm a very visual person. He drew out every procedure. I like the fact that he does my learning style because then I can know exactly what's going on.
It's a very exciting day, obviously, this partnership, because obviously Forest Park Medical Center believes in excellence. We pride ourselves on world-class service, and what better world-class organization is there than the Dallas Cowboys?
The cultures are so aligned. It's two groups, people, two teams that are really focused on excellence, have a passion for excellence. And it takes the same sort of things to make it work, because it's a team effort in the hospitals as well as on the field. You need the coaches, you need the players, the trainers, you need all the equipment staff here, and in the hospital, the nurses and the physicians, the technicians, all the people who maintain facilities all have to work together.
And really, if you think about what we do in healthcare, surgeries and the complexity of putting together a team, we honestly play the Super Bowl every single day, every patient. Our surgeons are quarterbacks, and they've got a team of great associates. Everybody's got to be the best and brightest at what they do, and together they can finish a game and score a big win for a patient. It's very much like football.
Our goal for Forest Park Fort Worth is really focused on excellence and innovation, and that's what the Cowboys are about. They have a strong tradition of really excelling at what they do, and that's what Forest Park does. We think that is going to be really significant to the community and to their surrounding communities, and we think that not only will Cowboys fans love the Cowboys this year, they're going to love Forest Park.
And if you look at the Cowboys, it's excellence year after year. It's an awesome partnership. The excellence of the Cowboys and the outstanding patient care and customer service at Forest Park Medical Center, you couldn't ask for a better team.
This is the Injury Report. I'm Dr. Stephen Michelson, orthopedic surgeon with Forest Park Medical Centers. Turf toe, an injury that affects several athletes and can put them on the sidelines for weeks or even months. Essentially, what is turf toe? It's basically a sprain to the great toe involving the ligaments and supporting structures on the bottom of the great toe. The term turf toe came about with the introduction of artificial playing surfaces. The joint involved is called the metatarsal phalangeal joint. Essentially, the long bone of the foot called the metatarsal and the phalanx or the great toe. The first joint is the main joint. It's surrounded by important supporting ligamentous structures as well as tendons and soft tissues and joint capsule. Essentially, injury to this involves varying degrees of stretching, partial tearing, or even complete disruption and dislocation of the joint. Treatment of all the injuries, grade 1, 2, and 3, involve the Rice protocol. This includes rest, icing, compression, and elevation. Also included is some anti-inflammatories, and additionally some supportive devices which may include a hard-soled shoe or a boot. Grade 1 injuries typically resolve within a week or 2 weeks. These are treated with the Rice protocol as well as supportive taping and an insert in the shoe called a Morton's extension. A grade 2 injury is a slightly more severe injury involving partial tearing of the plantar complex. Initial treatment with the Rice protocol, in addition to anti-inflammatories, as well as taping, sometimes a hard-soled shoe or a boot for a short period of time. Range of motion is initiated as soon as the swelling decreases and the patient's able to tolerate. Progression into a regular shoe with an insert called the Morton's extension to provide increased stability and support to the great toe. Grade 3 injuries or much more severe injuries can be associated with dislocation as well as bony injury or cartilage damage. These sometimes are assessed more with an MRI to assess the need for surgical intervention. Patients are initially treated with the Rice protocol, as well as taping, sometimes casting, hard-soled shoe or a boot. As symptoms resolve, patient is progressed to a firm-soled shoe with an extension, continued physical therapy. Progression to activities could involve 6 to 8 weeks or even longer. Surgical treatment involves reconstruction of the plantar plate, reestablishment of stability of the joint, occasionally fusion and correction of a deformity. Although a turf toe injury may seem like a minor injury, it can sideline an athlete for several months, the entire season, or even potentially in their career. This has been the Injury Report with Dr. Stephen Michelson for Forest Park Medical Centers.
Forest Park Medical Center is your destination to better health. Speaking of better health, let's take a look at another doctor who has changed many lives. Dr. Stephen Hardeman is a urologist here in the Austin area. Now let's take a look as he discusses kidney tumors with one of his patients.
I was in good health, and I started urinating blood. Went to the emergency room. The emergency room doctor said, let's get a CAT scan, and she came back and said, do you have a urologist? I guess it's pretty easy to diagnose if you have a spot on your kidney, it's a tumor. Finding out you have a tumor is a scary thing. I didn't know what kind of cancer, you know, is this going to be something that was going to be life-ending? When I was talking to Dr. Hardeman, he went over a lot of options, but they all boiled down to the best thing to do would be to take the kidney out.
Kidney tumors are a little unusual in that they still remain a surgically manageable disease. There is no very effective radiation therapy or chemotherapy for kidney cancer. So when they're discovered, the primary therapy is surgical removal of the kidney cancer. Normally when we remove somebody's kidney and discover that there's a tumor there, we have to follow them up for at least 10 years. And that requires monitoring with things such as chest x-rays, blood tests, and recurrent CAT scans to make sure that the tumor hasn't recurred. As far as a cause of kidney cancer, we've been trying to find out for many decades now. We haven't identified a specific cause.
My recovery process was really unexpected. There was very little pain. I was up walking the next day. I've been clear for a year since the operation. I'm doing good. I have no metastases, no signs in my laboratory work of any problems, and I certainly feel good. I feel real good. I would go back to Dr. Hardeman because I like the way that he talks to me, the way that he's thorough. He's straight from the shoulder, lets you know what's going on and what your options are. By guiding me like that, I think my wife and I, we had the best outcome because of the kind of guy he is, the kind of man he is, and the kind of surgeon that he is.
The most rewarding part about Texas Fertility Center being affiliated with Susan G. Koman is the ability to really get back to the community and to promote awareness of this aspect of what we do. So every year we have a big group, a big team that comes together. We associate with several other OBGYN groups in town who have staff members and physicians that all join the TFC team, and we have t-shirts just like all the fun teams do, and we go out there and support the cancer survivors as well as all the women and families who have someone who's struggling with cancer now.
We're just so excited to be a part of this race. The Koman Foundation is a very important foundation, and what they've done is phenomenal for so many people. And we're very proud to be associated with them. We're very proud to be members of Doctors for the Cure. And we're so happy that we can get such a big team out here under Wendy Blocker's direction, who is one of our marketing people, and she is just an incredible motivator. And she's done a great job of building team spirit and building so much excitement around this race. And this is something we do every year. And again, we're just so happy to be associated with the foundation and to be a part of the race.
I think the race is already a huge success. You just look out here in the crowd, and there are just all these people and families and friends together celebrating all these great survivors and honoring the people that have lost their battle of breast cancer, but we're all doing it together, and I think it's great. We've got a lot of people and a lot of excitement, and it's great.
This is our third year to sponsor the race, but the last 2 years are really the 2 years that we've had big teams that have showed up en masse, where we'll have 80 to 100 people on the team. Our employees, their families, we have patients that walk with us. It's really, really a good celebration of life.
I think this race is fantastic for survivors and their families because it encourages hope. It gives them something to look forward to every year, and it's just a reward for their travel, their journey, what they've been through, and to be able to get together and celebrate with their families, with their community, and with other people that are still on this journey. It's just a day of celebration for them. So this race does all of that.
It's a beautiful day. We're out here support of Koman GFIT Foundation, and I'm personally running for my mother-in-law, Linda Wilson, who's a 5-year survivor. Koman Foundation does so much for counseling our patients and their families who have or are facing breast cancer. They provide a tremendous amount of resources, and they help us in counseling our patients, specifically for fertility issues when it comes to breast cancer and diagnosis.
We have a really unique relationship with Susan G. Koman, in that probably close to 10 years ago, the oncologist in town started aggressive therapy for women who are young who have premenopausal breast cancer, and it has a very, very high cure rate. But unfortunately, some of that aggressive therapy that results in a cure can also cause significant problems with infertility down the road. So we worked with many organizations, Koman in particular, in really trying to promote fertility awareness and particularly fertility preservation awareness. And we are set up to do elective egg freezing, elective embryo freezing, where individuals or couples can come in and say, we're faced with this treatment that is going to be ongoing for maybe the next 3 to 5 years, and we don't want to lose our opportunity to start a family. So we have the ability for women to be able to freeze their eggs prior to initiation of therapy, particularly if it's a therapy that's likely to render them infertile down the road, or for couples to retrieve the eggs, go ahead and fertilize them, and then freeze embryos so that as soon as they have the green light to attempt pregnancy, we're ready to go.
Linda has a question for Dr. Paul John. When does my daughter need her first pap smear?
The rules have changed on that, actually in favor of the young women, because we used to make them have pap smears at a much earlier age. The answer to the question is usually when they become sexually active. The other part of that is that we also counsel them on the causes of cervical cancer, which we know now is the human papillomavirus. And we have a vaccine for that. It's a good time at their first pap to talk to them about that.
Lodging provided by Radisson Hotel and Suites. Thank you everyone for joining us on another episode of Best Docs Network featuring Forest Park Medical Center right here in Austin, Texas. For more information on any of the doctors you've seen on today's show or to request an appointment, please head to our website, bestdocsnetwork.com. We love hearing from our viewers, so if you have any questions or comments, please feel free to email us at info@bestdocsnetwork.com. So long everyone, and we'll see you next week.